Hello, everybody. So, welcome back to the channel. Today, we are starting a new series 12 days, 12 different systems, and 12 different important mechanics to management operations. Absolutely. So, whether you're a nurse, whether you're a doctor, whether you're a pharmacist, whether you are any professional, you must know the basic organs and the organ system. Suppose today's system is pulmonary system or the respiratory system. So, the respiratory disorders, the cardiorespiratory, metabolic respiratory, neurorespiratory disorders. What are the different organs what are the different components of the respiratory system, right from the trachea, nasopharynx, oropharynx, laryngopharynx, nasal conchae, nasal nostrils, nasal cavity, bronchi, bronchioles, lungs, alveoli, pleural membrane, pleural cavity. You should know about the pathophysiology, how a disease occurs and what are the different symptoms, signs that are occurring like wheezing, dyspnea, apnea, chest stabbiness, tightness of the chest, right? The different disorders like these asthma, COPD, emphysema, asbestosis, silicosis, acute respiratory distress syndrome. Then you have pulmonary embolism, pulmonary fibrosis, non-small cell lung carcinoma, small cell lung carcinoma, the therapeutics, and how will you diagnose them? The radiological diagnosis. All of them must be known to you. So if you're a healthcare professional, this is the best video for you because I'm going to cover everything in one class today. So this is how the upper respiratory and the lower respiratory tract system looks like. Nostrils, nasal cavity. So here you have the nasopharynx, oropharynx, laryngopharynx, the larynx. Then there's a windpipe, which is trachea. So there's an upper respiratory tract infection and lower respiratory tract infection, which occurs in LRTs. So here you have the bronchi, main bronchioles, primary, secondary, tertiary bronchioles, and alveoli. The primary function is air filtration because mucus helps in the humidification and protection from pathogens as well. Talking about the microengine, so here you can see type 1 pneumocytes, which are responsible for the gaseous exchange, type 2 pneumocytes, which are responsible for the lung surfactant production. And let me tell you that, diagnosis is very, very important. When you have to perform chest x-ray, like if you are having infections, tuberculosis, pneumonia, chest x-ray is important, right? Acid fast base smear is important. If you have some other breathing problems, then you have to go for the other spirometry, pulmonary function test, FEV1, FVC tests, right? So when you have to perform which techniques, which staining, that must be known to you. And what are the signs and symptoms? All right. That must be at the tip of your tongue. So the mechanism of ventilation involves inspiration. So the volume of thoracic cavity increases, pulling the ribs and sternum outwards, due to which the diaphragm contracts. In the expiration, the diaphragm relaxes, pulling the ribs and sternum inside, and there is a control center of the respiratory system, which is a medulla oblongata. As the hypothalamus is a thermoregulatory center, the medulla is a respiratory center. So there's exchange of gases which occur. Oxygen is transported 98% bound to hemoglobin. That is why ischemic condition or hypoxia condition. Hypoxia is lack of oxygen, ischemic is lack of blood supply, or hypercapnia when there's excessive carbon dioxide. All of these are detrimental. So you have oxygen dissociation curve and Bohr's effect, a lot of different effects and theories, postulates which are being formulated for the respiratory tract system, right? And most of the carbon dioxide is found transported in the form of carbaminoglobins or bicarbonate formation. So where you can see that the gaseous exchange disease are mainly because of vascular failure, blood flow decrease. Restrictive lung disease are because of the stiffness of the lungs, especially pulmonary fibrosis and sarcoidosis. Obstructive lung disease because of bronchitis, emphysema, asthma, and other conditions, right? In which there is narrowed airways, difficulty in the breathing. So where you can see that in the COPD, there is irreversible airflow, chronic inflammation, excessive sputum production. So you need to identify the cough also. Cough is a protective reflex. If it is a dry cough, it can be treated by the antitussives as it's an unproductive cough. If it is a wet cough, you need to give an expectorant which will expel the mucus, all right, it is a productive cough. So mostly you check the spirometry test in which you check the reduced FEV1 and also the treatment. Can you use inhaled corticosteroids or you use bronchodilators or you use anti-inflammatory agents? Or are you going for CPAP, BPAP, oxygen therapy in case of acute respiratory or some other chronic respiratory collapse or respiratory failure like conditions? So that must also be at the tip of your tongue. You must know about this. It is very, very important. It is very, very commonly asked. All right. Acid fast smear, gene expert nowadays, hemoptysis, the vomiting mobility. So here you can see that the pathophysiology, mostly the pulmonary embolism, fibrosis, all of these conditions are scarring of the lung tissues. So you have to do bronchoscopy, you have to take out the biopsy tissue, you have to perform the D-dimer test, CRP for the inflammation, or computed tomography, pulmonary angiography, CTPA testing that are very, very important to check the pleural cavity pain or damage. Mostly you can perform the ossiculations. So with the help of a stethoscope, you can check the high, if you get a musical high pitched whistle, it indicates airway narrowing. That is why a doctor, this is the diaphragm, this is called as a diaphragm, uses a stethoscope not just to measure your heartbeat, also your heart beats around 72 beats per minute. You have 12 to 20 breaths per minute. Okay. Heart beats and total breaths is 12 to 20 breaths per minute. All right. So the sputum color, many times you take out the BAL fluid, bronchoalveolar lavage fluid, and check for the infections, inflammation. So the sputum color is green, indicating inflammation. If it is pink, indicating edema. So here you can see chest X-ray for pulmonary embolism, staging cancer, fibrosis. You can check out FEV1, post-expiratory volume, and FVC, vital capacity, different lung volumes. You can check out the arteriolar blood gas, whereby you can check the pH, PO2, SpCO2, other levels and all. Okay, so that must be known to you. So bronchodilators, may you have beta 2 agonists, anticholinergic agents that are useful for the COPD maintenance and asthma rescue. Then you have anti-inflammatory agents with like steroids, oral steroids, as well as inhaled, like budesonide, beclomethasone, they are inhaled. Oral may you have prednisolone or dexamethasone, and all those are oral steroids. So for the management, you should know when to give the oxygen therapy, when to give the non-invasive ventilation like the CPAP, BiPAP, when to give the important mechanical ventilation, what is a prone position, especially in acute respiratory distress syndrome, there is a high requirement of the prone positioning. Okay, so BiPAP is a very important non-invasive technique, machine bi-level positive away pressure. Okay, and also in neurological conditions like amylotropic lateral sclerosis or sleep apnea, it is very commonly useful for the, especially during sleep. Okay, for a great sleep. So this is a small machine that comes. So you wear this mask because sudden wake up, there's a sudden stop of the oxygen and the flow of the oxygen, and you wake up. So you have acute asthma attacks, tension pneumothorax, pulmonary embolism, acute respiratory distress syndrome, sepsis, right? So infectious disease हो सकती है, restrictive lung disease हो सकती है, morphological and structural disease हो सकती है, functional हो सकती है, genetic हो सकती है. Lot of different types of diseases can occur. So stay connected with me in this 12-day series because daily I will be giving you new updates, new series, and new organ systems. So 12 days, 12 organ systems, and multiple diseases of those systems, whether it is cardiovascular, neurological, nephrological, hepatological, hematological, pulmonary, dermatological, right, endocrine, musculoskeletal, all the systems, their anatomy, physiology, pathophysiology, diagnosis, and therapeutics. Thank you so much, everybody.